This is something we think about a lot, and I've condensed it down to three. I think we got three big messages, or at least our coalition learned three big lessons, and it's three Ps: plans, payment, and partnership. So we learnt that national governments, particularly those with large medical oxygen gaps, they need plans, national plans. They need to get a handle on how much oxygen they need in their health system, what types of oxygen they need, like liquid, PSA, VSA plants, concentrators. There's lots of options out there. It's different for different countries. They need a different mix. What are their people needs? How many biomedical engineers do they need? Are their clinicians trained? They need plans. It's much, much easier if you have a national plan to work with industry and to work with foreign aid, if you like. And you minimize the risk that you're going to be inundated with donations of medical equipment that you don't need. You minimize the duplication of effort, and you minimize there'll be gaps, large areas left uncovered. So plans, plans, plans. And we're lucky that the WHO, the World Health Organization, is now very, very active in this area. They have an oxygen resolution that went through the World Health Assembly. All 194 governments are represented there. So they've all committed to having plans. So WHO has really stepped up there, and kudos to WHO. The second P is payment, and this is the weakest spot. Industry will tell us if a country doesn't have enough medical oxygen, it's because they're not buying it. Where there's a buyer, there's a supplier. This is the way the market works. So we know that the payment system wasn't working in many countries because there was no buyer. So we have to get the payment right. And we would like to see more domestic funding going into oxygen. Countries need to spend their own money. Ministries of finance, ministries of health need to put oxygen in the health budget and in maybe other budgets as well, to make sure they're contributing to that. And some countries can take care of all of that themselves, but a lot of countries are going to need foreign aid, international support. And that's where we needed a much more robust system of financial support. We are taking big steps toward that, just getting the global fund involved in oxygen, which it now is. And for those of your audience who don't know what the Global Fund is, it's our largest global health agency that's been helping countries for many years take care of their HIV, AIDS, TB, and malaria challenges. And they've done a brilliant job in those three areas. But thanks to the leadership of Peter Sands and the board at the Global Fund, they understand they need to be active in medical oxygen, and they've provided so far more than $700 million of foreign aid, if you like, to more than 100 countries. And they want to stay in the game, and we want to keep them in the game. So payment, we have to get the payment right, and that's when industry will come in. And the third one, particularly for this audience, is partnership. Prior to COVID, there really weren't any effective partnerships between global health agencies and the oxygen industry. So when we had to come up with an emergency response, a lot of those relationships had to be built from scratch with the big liquid oxygen companies like Air Liquide and Linde and Air Products. We had to strike relationships with the PSA, VSA plant manufacturers like Novair and PCI Gases, and then all the little mobile concentrator companies, Drive to Vilbus, you know them, there's a multitude of them. And then all the peripheral companies making pulse oximeters and masks and patient monitors, the surround sound of the medical oxygen industry. We didn't have any real way to communicate with them. Gasworld was a huge help to us, have to say again, in building those relationships. But they're still not rock solid. We still have a long, long way to go. But we now have the Global Oxygen Alliance. I'm sure Thomas, when we hear from Thomas, will talk more about that. And this is a great, great way. This is the foundation of building partnerships for the future. And I call on industry who are listening today, you really need to work with the Global Oxygen Alliance to really strengthen the partnership between industry and the public sector or global health writ large, because this was such a weak spot, and we wasted so much time in 2020, 2021, because we didn't have partnership with industry. So plans, payment, and partnership.